I'm about to bust some of the biggest myths around knee pain in veterans so you can get back to running, rucking, and lifting without fear. I'm Dr. Ray Peralta, physical therapist, Marine veteran, and run coach. And by the end, you'll know what actually causes most knee pain and what to do this week to reduce it. And stick around, I'm going to bust these myths, show some fixes, and a simple starter plan you can do to begin today. So, knee problems are unfortunately rampant in the veteran community. The VA's health data shows in 2024 that there's a lot of veterans who have limitations just bending their knee. It's one of the most common limitations in veterans, and is also one of the most common service-connected disabilities, with 150,000 veterans being compensated and millions receiving benefits for just knee conditions overall. But the high prevalence doesn't mean you're doomed, and most knees respond to smarter training and better daily habits. So, myth number one, I wrecked my knees from years of rucking or rucking. It's usually undertraining, not overuse, that bites us. See, the body hates big spikes in load, not consistent, gradual work. So, what you need to do is start building up your tissue capacity, right? So, maybe even though you may train and maybe you train on the weekends or something, right, like a weekend warrior, oftentimes you're not training your knee in the certain ranges that it needs to tolerate. Oftentimes it's bending, the knee bending ability to go kind of deep, like squatting, lunging. So, and it might hurt. You're like, wait, I don't want to do that because it hurts your knees. So what you do, you start building up your capacity, slowly go ease into those painful ranges. And then over time, you start building up and going deeper and deeper. And for other people, it's just they don't get enough movement. So for those folks, let's say you just have a sedentary job, you work a desk job, something, just get up, start walking, rock every day, right? Build up to like 30 minutes a day, and then even up to an hour, right? So 30 minutes to an hour. And if you want to take up like endurance sports, maybe you want to get into running, do run walk intervals, and then progress every week or so. Try to, 5% or so. It's going to vary based on your fitness level, but try to just progress week by week. Maybe you do more time, more distance or mileage, and then you could ramp it back every third or fourth week, and then keep cycling kind of like a step, kind of going up, and then a little temporary break and back up again. Start building up your fitness. Same thing with strength training. You also want to strength. I mean, a lot of times there are people a lot of veterans who are like, oh, I do strength training, but oftentimes either they don't do it enough, or it's oftentimes just not doing enough. Like I'll do legs once a week, and then I'll do some core and upper body or whatever. But actually, the minimum is actually twice a week for each major muscle group. So when it comes to legs, you should be training your legs twice a week. And oftentimes they only do one or two leg exercises. Maybe like, maybe we'll just do a squat, or maybe they'll do a calf raise. But instead, you should be doing a series of different leg exercises. For the quads, actually need a lot of high volume. So you may have to do leg extensions, split squats, lunges, lateral lunges, deadlift, like a whole bunch of different exercises to target, especially areas like the quads or calves. When you got to build them up, and strength, you think it's like body armor or joint armor. It could help you prevent injuries or future injuries. And if you're already dealing with knee pain, it could also help you start decreasing the knee pain. And other exercises are step up, step downs, deep lunges, a deficit lunge, where you're just doing a lunge off a step. So many different exercise variations out here. And again, you want to progress slowly, track your pain levels, right? See how you're feeling. If the pain, I always tell people, hey, use a pain traffic light guide, but essentially it's like mild, moderate, severe pain. If it's mild to moderate, you can continue. Moderate, you may just have to modify your training. And if it's severe, you're going to have to back off and work with a healthcare professional, like a movement professional, someone like a physical therapist, someone like myself. If you're dealing with like severe pain, that's really kind of limiting you and stopping you. But even the moderate category too, you could also benefit from that, working with a professional. So there's a client who I worked with, retired veteran, military vet, who was tired because his knees he felt like they were damaged from like rucking. He was in the Army. He thought, from years of rucking. And he didn't know what else would we do. I told him, hey, when we just have to lower the volume, because he was also an endurance athlete. He was doing lots of running mileage. He was running like 5-6 days a week. We had to decrease the volume a bit, focus more on doing quality strength work, because he was doing some strength work, not enough. And then we rebuilt back to doing pain-free 5Ks and 10Ks in just 2 months. Myth number two, my job wore my knees out. So age, since I'm getting older, I have to rest. Well, that's a myth. In fact, being sedentary and just taking it easy all the time leads to deconditioning. And that's going to be more of a bigger issue than just your age, right? So Movement is medicine, right? Motion is lotion. So for these folks, again, it's getting movement and tell, hey, have a baseline minimum, right? Try to, again, get your daily steps in. If you don't want to use the time I talked about 30 minutes earlier, you can also track number of steps, right? Hey, try to get 5K steps, then 10K steps, or 10,000 steps a day, right? You can track it. A lot of smart watches, smartphones, etc., are going to help you track your steps. And now you can track your steps. And then as that becomes easy, you can start integrating some other types of aerobic exercise, where you could do some run walk, biking, swimming, rowing. So you even do rucking, actually. Even but rucking, start light. Don't jump right to like a heavy load. All right, start light. Maybe start with just 5% of your body weight, and then start building up from there. You don't even have to go that heavy with rucking. You could do like 30 pounds, 35-pound pack, and that's what I'm, especially trying to go do that for 6 miles a ruck, or even building up to like 6 miles and above. That's already a decent workout. And then for hourly movement breaks, right? Especially if you have a desk job, get up out of your chair every hour, or if you're standing too long, change out of that position every hour. Maybe just walk for 2 minutes or stretch for 2 minutes, right? Do something for 2 minutes just to break up that stationary activity, and that can actually oftentimes helps people with knee pain get relief. And if you're overweight, consider also losing some weight. Even just a 5% reduction in body weight can lead to noticeable reduction in knee pain. So even myself, while I was dealing with knee pain and I was a bit overweight, I just noticed, hey, just getting a bit leaner. I was a student I was a grad student, and I was like spending long hours sitting. One of these things that helped me get rid of the knee pain was just get up out of my desk every hour or so, and then just start working on losing the weight. And then that knee pain got less and less and less just by making these lifestyle changes. And then I was able to walk and then do run walk. Myth number 3, imaging says damage. So I need to get a knee replacement surgery. I need to get a knee surgery. So the thing is, scans show abnormalities even in people without pain. See, what the imaging show, those labels, doesn't always mean that's the actual cause of the pain, right? So many pain-free athletes, right, people who even at professional elite levels may show changes on their imaging, like meniscus damage, cartilage changes on the MRI, yet have no pain. Right, so the findings doesn't always indicate that you need to jump right to surgery. Right, if you're considering surgery, you want to get a second opinion, because sometimes the first opinion, again, I'm sure they're a well-meaning surgeon, but often you do want to get a second opinion, especially if it's like a major surgery, like a knee replacement surgery. Right, try conservative care first. Right, so whether to work with a physical therapist, right? Especially if you haven't already, and maybe you've tried some in the past, but work with one who understands what your needs, especially if you're trying to be like a high performer, you're trying to run, you're trying to lift, right? You're not just content with doing basic everyday, day-to-day things. You want to like take it to the next level. Work with like a sports physical therapist, someone who really understands, hey, you want to get back to sports, right? So working on strength and mobility work, graded exposure often outperforms just bed rest or getting massage. Sometimes people think, oh, I just need to get a massage or acupuncture. No, it's actually the active treatments, the proper strength training, the proper mobility drills. It could be confusing though if you don't know what you're doing. You're like, oh, I strengthen, I do squats. The thing is, there's so many different ways to do squats. There's so many different ways to do mobility drills for your knee that it could be confusing unless you're already a physical therapist yourself. Oftentimes, just working with one can help you get rid of the guesswork instead of just trying to rely on the free generic stuff you find on Google or YouTube. Because oftentimes, again, unless you know what you're doing, it could be pretty confusing to put it all together to actually make it work for your specific situation. So I had a veteran who had an MRI that said some scary stuff. Right? He had a meniscus tear, arthritis, degenerative changes. He was considering getting like a meniscus knee surgery. However, we worked together in like 6 weeks. He canceled the surgery because he was feeling so much better. He was able to run and lift, and we just worked on some basic stuff. But I applied it for his situation. Like he needed to restore knee extension, so we started doing some knee extension mobility drills. Did that every couple of hours. Started strengthening his quads, did some terminal knee extensions, step ups, all these different types of exercises in combination. But he was able to cancel his knee surgery, right? But again, everyone's going to be a bit different just because what works for him may not work for you. You have to try, again, a different strategy, and working with a movement professional can help. Right. So the simple starter plan 1, if you're not already walking, right, aim to walk at least 150 minutes a week, which is essentially walking 30 minutes, 5 days a week. Strength training at least twice a week. And no, just doing legs once doesn't count, right? Do it at least twice a week. I actually recommend doing full body. That way you don't neglect the body part or muscle group, right? So just train full body twice a week. Right. You could do single set routine, but if you really have a lagging area, like let's say your knees particularly weak, you may have to do multiple sets. Sometimes you have to do 3 sets or 4 sets, especially if you notice that, hey, your knees are particularly weak. Other body parts you can stick with 1 set, but if you notice, hey, that your knees are the problem area, sometimes you do have to do multiple sets for like that lagging area. So again, exercise, split squats, squats, leg presses, step ups, step downs, and even train below and above. So do calf raises, right, to train the calves, the lower leg, and then train the glutes, bridges, hip abductions, walkouts, and then work on mobility, hip stretches, couch stretch, knee mobility, extension, flexion. A whole series of exercises. And then if you have a sedentary job, whether it's retail or a desk job or something, get up out of your chair, move every hour or two, right? Just got to get more blood flow circulation. And then over time, you can start increasing either the amount of cardio you're doing or the amount of strength training you're doing. Try to go a little bit heavier, try to do more reps, or try to spend more time on your feet. I mean, moving around, and you'll start building up. And another tip is actually spend some time being barefoot. 'Cause oftentimes the ankle and the foot can influence the knee. So oftentimes just training barefoot, when it's safe to do so, like just around your home, just go walk barefoot. If you live like in an area where you have like a park that dogs aren't pissing all over the grass everywhere, that you could just walk barefoot in the grass or the sand. Oftentimes just walking barefoot helps retrain the foot. We could actually help the knee as well. And then obviously, if you've had major trauma or anything like that, go to urgent care, go to emergency room, right? Because if you had like major, like you just in a car accident, obviously this advice is not going to apply to you, right? The disclaimer: go see a healthcare professional if you just had like obvious trauma or some kind of clear, like you were just tackled or fell down some stairs or something like that. Go see a healthcare doctor urgently. So anyhow, just to recap, overuse is the villain, underprepared knees are. So move more, strengthen smart, and progress gradually, right? Imaging doesn't have to be a life sentence. Oftentimes doing the proper training, smart training, strength and mobility work can help most types of mechanical knee pain. So if you found this useful, you want additional help on how to run or lift pain-free, check out my free school community, a link in the description. I do have plans here for all sorts of injury, knees, especially because knees are the most common, but also back, hip, ankle, etc. You can do Q&As there. And I'm also doing a 28-day Operation Pain-Free. So if you want more one-to-one work, just DM me. You'll find me on Instagram or in school. You could DM me the word or the acronym OPF for Operation Pain-Free to join my 28-day pain-free challenge. So my Instagram handle's at Dr. Ray _Peralta.